Hi, my name is Carrie Davis from UHS Community Relations, and I am live today on Facebook at the UHS Orthopedic Center in Vestal. And we're here to talk with you today about our sports-related concussion program. I'm joined by Dr. Hunter, who is our fellowship-trained sports physician, and Chariese Medlar from our physical therapy department. Thank you for joining me today.
Thank you.
So we're here to talk about, we're into the fall sports season and contact-related sports our youth are participating in. What can you tell us? We'll go into some information about the UHS sports-related concussion program, but first of all, Dr. Hunter, what can you tell us about concussions and what we should look for in our young athletes?
Well, it's very important to recognize concussions. That's the first step. And basically any time that your head is hit or undergoes a sudden acceleration and then you have symptoms such as headache or dizziness or mood changes, that would be indicative of a concussion. And if that happens, you should remove the player, the person from sports, and have them evaluated by somebody with expertise in concussions.
Yeah. Now, what are the ages that you see people coming in with concussions from sports-related events?
Well, our concussion clinic sees people from all ages, but we certainly see the most of young athletes, and that starts when contact sports start around 5 or 6 years old and goes right up through. We do a lot of collegiate coverage.
Great. You know, why do we care so much about concussions, and what's the impact on it?
Well, we know it makes a big difference in your long-term outcomes, how you treat a concussion. Failure to recognize them and remove people from play and to give appropriate treatment can have long-term detriments and cause people to have to retire from sports and even have cognitive problems years and years down the line.
Yeah. Now, what should a parent do if they suspect that their child does have a concussion?
Well, the first thing is, if in doubt, because you often have some doubt, sit them out, take them out, and have them evaluated by somebody with expertise in concussions. And UHS has a lot of athletic trainers at a lot of events around the Broome area, and so there may even be someone from our team who's there who's able to give an evaluation.
Yeah, we talked about this a little bit, but again, what are some of the signs to look for if your child is playing in athletics or your older child is playing and they've been hit or had some sort of contact? What are the symptoms to look for again?
So the most common symptoms that present with concussion are headache and dizziness, but there are a lot of things. It can be mood changes, difficulty sleeping, difficulty concentrating, difficulty with memory, so pretty much anything that you could attribute to brain function.
Yeah. Okay. Now, what do you do if there's not a UHS athletic trainer at the event, or it's the next day and you still suspect that something is wrong? Chariese, what are those steps that you would take as a parent?
So a parent can call the concussion hotline, which the number is 644-3884, and that will dial right into an athletic trainer. If for some reason you get a voicemail, then you can leave a voicemail of your child's name and your name and a contact number to get back to you. And they'll schedule you for an appointment with the sports med doctors.
Great. Now, if someone does have a concussion, Dr. Hunter, and they come here to the sports medicine program to see you at UHS, what are the steps that you take for treatment?
First, we do an initial evaluation and try and determine whether they truly do have a concussion, and then no two concussions are the same. Sometimes we do treatment with physical therapy. We have a number of physical therapists with expertise in doing rehab from concussions. Sometimes people can go through that with an athletic trainer in their schools. Some people just need to rest for a little while. We can help with academic accommodations while they're getting back to speed. And we can take it as far as it needs to go. We have experts in other areas like neuropsychology, neurology, physiatry. So, we can handle concussions from the simple to the complex.
Okay, and that's all offered here at UHS Sports Medicine,
part of our center,
program.
yes.
Great. And how long do you see students being out of sports after a concussion? Is there a certain length of time, or time to give them to rest?
Well, the average duration is around 2 weeks, but it is notoriously difficult to predict how long a concussion will take to recover initially. So we just have to go by symptoms and their clinical course.
Any suggestions that you can give parents out there, or coaches, things like that, to avoid concussion?
So we do a number of things where we have our strength coaches in schools. We have them teaching kids exercises to improve neck strength. There's some data that may reduce concussions. Heads up and good tackling techniques, avoiding unnecessary contact early in the season, in the preseason, unnecessary hits to the head. Certain drills like the Oklahoma drill where people just run into each other are now widely thought to be detrimental. So changing the way sports are played, the practices, free catch rules, a lot of that is
Okay.
helping to reduce concussions.
Okay, great. And we've got a lot of that information on our website. We'll be putting up some more today, especially the concussion hotline number. We'll make sure that we have that up. What are some of the treatments that you do in physical therapy, Chariese, when you see people come in with concussion?
So we can look at people from a physiologic standpoint, looking at their heart rate. As they increase their heart rate, are they getting symptoms? We look at them from a vestibular standpoint. Are they having problems with their vestibular system and their eye system? As well as just working on their balance and trying to get them back to everything Dr. Hunter has already talked about. Trying to get them back to school and academia first, but then ultimately trying to get them back to their sport and full function.
Great. And we do have 2 fellowship-trained sports medicine physicians, Dr. Hunter and Dr. Sadowski, also.
We also have a fellowship where we train other physicians who apply and want to become sports medicine physicians. So
Great.
we always have a fellow in training as well.
Great. It sounds like we have a wide scope of a program here, so that's wonderful. And again, we'll put information up on our website today, but Chariese, one more time, what's that, the hotline number again?
Yes, the hotline number is 644-3884, and we also have physical therapy locations in Vestal, Schnagel Bridge, and Endicott.
Okay, great, and all that information is on our website. Thank you for joining us today. I know for parents out there with youth playing sports that this is great information for everyone, so thanks to you both for joining
My
us
pleasure.
today.
Thank you.